What I'm hearing you say is that the gut, the microbiome, and these bugs have a lot to do with how you can live.
The more diverse your microbiome is, the longer you live and the longer you live well. So,
Dr. Stephen Gundry made a jaw-dropping statement during his interview with lewishowes, claiming that the average person carries around 4 to 5 pounds of bacteria in their gut. These microorganisms, according to Dr. Gundry, have a profound impact on our health and lifestyle, depending on their type. He explains to lewishowes the food we consume directly influences the kind of bacteria that thrive in our gut. Let's dive into this video of Dr. Stephen Gundry absolutely shocking lewishowes with his incredible statements.
oh,
Why is that?
turns out the distinctive set of bugs that has now been found in pancreatic cancer in humans that predicts. And so there's an exciting new thing that you could take a swab of your tongue and sequence which bugs are in there, and you can go, oh crap, you've got a pancreatic cancer microbiome. Now, the good news about that is that you can alter that microbiome. But a paper just this morning, they literally stuck needles into the pancreas of people that were, looking for pancreatic cancer. And they were looking for pancreatic cancer cells, but they're looking under the microscope and they go, wait a minute, there's a bunch of bacteria sitting here inside this, pancreas. What the heck are those doing in there? So then in 105 people, they sequence those bacteria, and they were all exactly the same sorts of bacteria, and they actually all came from the mouth.
Wow.
Yeah.
Doesn't most, I heard this from a oral, hygienist or dentist or doctor who said a lot of the disease we capture is through the mouth.
Yeah, correct. Dale Bredesen, who wrote The End of Alzheimer's, who's become a good friend of mine, he and I are fascinated with the effect of the oral microbiome on dementia. And for instance, in the plant paradox, I wrote about there's kind of a fun study in rats where you can take LPSs, lipopolysaccharides, which are the outside wall of bacteria. They're not living bacteria. They're just the dead bacteria. And in my book, I don't swear, but I call them little pieces of shit because that's what they are. LPSs, they literally are dead bacteria. And so you can take rats and you can swab one of their noses with LPSs. They're not living bacteria. They're pieces of dead bacteria. And the other side of the nostril, you can just put a cotton swab with nothing on, right? And you do that every day. The rats who get the swab up one side of the nose, their other side of their body gets Parkinson's disease.
No way.
Yeah, gets Parkinson's disease. The other side, the opposite side, doesn't. And you go, what the heck is going on? Well, if you think about it, your nose and your mouth are gateways to your brain. I mean, literally the back of your mouth and the top of your nose is your brain. Your brain's just sitting there. And so this is a direct shot into your brain. And as I talked about it in the plant paradox, but I really go into this in the longevity paradox, that to prevent Alzheimer's and to prevent Parkinson's and dementia, one of the things you got to do is the care and feeding of your microbiome, and that includes your oral microbiome, because this is a direct shot, and you got to take care of it.
So how do you take care of that?
So there are, believe it or not, certain bacteria. One's called P. gingivitis that has now been isolated from the brains of Alzheimer's patients. And how did it get there? Well, it got there through your mouth, through bad dental hygiene, through gingivitis. That's how the name.
So you can get Alzheimer's through
your mouth,
not taking care of your teeth?
Exactly.
Really?
Yeah. And in fact, years ago, I'm such an incredible nerd. There's a very famous marker of inflammation called a C-reactive protein, CRP. Almost everybody listening has probably had a CRP. There's a more specific one called highly sensitive CRP. Years ago, I noticed that a lot of my patients with heart disease had elevated CRPs. And I said, my wife flosses twice a day, literally. I mean, she's a nut.
That's good, right?
Yeah, it's great.
Well, for me, flossing every day causes discomfort, but there are a few alternatives that can provide similar benefits without being as painful. You can try using a water flosser. I think they also call it an oral irrigator, which uses a gentle stream of water to clean between your teeth and along the gum line. Interdental brushes are another option. These small brushes can fit between teeth and gently clean without the same irritation that flossing might cause. Additionally, dental picks or soft picks can be less abrasive on sensitive gums while still removing plaque and debris effectively. And my favorite, everyday, mouthwash. It's awesome.
I hate to floss.
I
hate
know.
it. So I designed an experiment with like 500 people, and I asked them to floss every other day. Okay? And we'd measure their CRPs, and then we measured their CRPs every 3 months for a year. And the people who I could get to floss every other day, and that included myself, their CRPs came down to normal, and they were elevated. And the people who flossed more than every other day, they had even lower. And so I wrote this paper for the American Heart Association that says that since CRP is very highly associated with developing coronary artery disease, that coronary artery disease, in fact, partially comes from the mouth.
Wow.
And if you want to prevent coronary artery disease, you ought to floss. I got honored by the American Institute of Oral Biology for my research. Everybody give me a big hand. But these dentists are right. You've got to, there's a barrier between the bugs that live in your mouth and you, and it's at your gum-tooth interface, and you've got to preserve that barrier. The same thing happens in the barrier in the wall of our intestines. So here's the deal. Your intestines are your skin turned inside out. That's all it is. That surface area of the intestines is the same surface area as a tennis court.
That's big.
Yeah, that's big. And everybody's kind of looking down there. There's no tennis court.
How's it fit in there?
Yeah, how'd they do that? Well, and we can do this because it's kind of fun. I'm fascinated with plants, as you know, the plant paradox. And, plants are actually very intelligent human beings. They actually see. A new book has proven that plants see. Anyhow, so plants have a root system in the soil that they get their nourishment. And those roots are surrounded by a microbiome of the soil. And there's fungi and bacteria. And it's actually that microbiome that gets the food into the plant, gets all the nutrients into the plant. So we actually have roots, and this surface area, those of you who remember high school biology, we have all these little projections called microvilli, and think of it kind of as a shag carpet. And so we have roots that go into our intestines, and everything we eat is actually the soil.
So our intestines are like the roots.
Yeah, our intestines. Out of our intestines are these roots.
Got it.
And the soil is what we eat. But the main component of the soil is the microbiome. So you've got 4 to 5 pounds of bugs
In my gut.
in your gut. And
Wow.
they're there. We used to think they were just a bunch of crap.
But we actually need it.
We not only need it, they control everything that's going to happen to you.
Do I want 10 pounds of bugs, or do I just want 4 or 5?
Well, actually, the more diverse set of bugs you have, the more kind of mixing pot United Nations of bugs, the better off you're going to be. In fact,
Why is that?
turns out, if you look at what's called microbial diversity. In other words, how many. We now know that there are at least 10,000 different species of bacteria that live in your gut.
Oh my gosh.
In fact, a few weeks ago, another 1,000 was found that nobody realized. So your gut is basically a tropical rainforest, and you've got all these creatures and things happening, and one creature depends on another, and if you tip the balance off, it's like introducing wolves back into Yellowstone Park, right?
Right.
Whoops, we needed wolves. Who knew?
Yeah.
Right. So there's this intense kind of communication dependence, and the more diverse your microbiome is, the longer you live and the longer you live well. So
Why is
So there's a few things I do to nurture the beneficial bacteria in my gut. Here are some key steps I take to improve overall gut health. I eat more fiber-rich foods. Foods like fruits, vegetables, whole grains, and nuts provide prebiotics, natural fibers that feed the good bacteria in your gut. I definitely try to limit processed foods and sugars. Ultra-processed foods and sugars can feed harmful bacteria and disrupt the balance of your gut microbiome. I try to stay hydrated, drinking plenty of water, because this supports healthy digestion and helps good bacteria thrive. Also, consider a probiotic supplement. A high-quality probiotic supplement can help restore and maintain a healthy gut flora, especially after taking antibiotics. And this is key. You have to try to manage stress. High stress levels can negatively impact gut health. So practicing mindfulness, yoga, or relaxation techniques can help maintain a healthy balance. If you follow these steps, you can create an environment in your gut where beneficial bacteria flourish, supporting better digestion, immunity, and overall health.
is that?
turns out that this root system is dependent on the nourishment it gets from all of these bugs.
Got it. So it'd be like if you're trying to grow a plant or a tree in a desert, it'd be challenging because there's not enough soil.
Yeah.
And it would only thrive for as long as it can, or
Yeah, in fact, you know,
you put an oak tree in a desert, I guess, or whatever. Right? It needs more nourishment than it's receiving there.
right. And you can actually, there's really cool experiments where you can have two identical plants planted right next to each other. And depending on the microbiome in that soil, one plant will thrive and the other won't.
Right.
But we can go down a rabbit hole. And
Sure,
it turns out in a forest, if trees sense that one of their neighbors is not doing too well, they will actually send roots and supports over to that tree.
That's pretty interesting.
But
Okay.
Again, we won't go down
Yeah, I
that
know.
road.
We can go down everywhere.
Yeah.
Okay, so all this so what I'm hearing you say is that the gut, the microbiome, and these bugs have a lot to do with how you can live well now, and also for extending life. Is that what I'm hearing?
Yeah. So you take 105-year-old people around the world, and you look at and these are thriving people.
Not like about to die, but
No,
they can move around. They can.
Yeah, it's like Edith Murray who starts the book.
Oh, wow.
That lady was 105 and a half when this picture was taken.
Wow.
And so she was in 2-inch wedgies. She walks her little Pomeranian, and she's smart as a whip, and she was one of the women who really changed my life. Her name's Edith Murray. She's Michelle in all my books. So anyhow, So you take these people and you look at their gut microbiome. They have the gut microbiome, the diversity of a 30-year-old individual.
Wow.
And if you look normally at people as they age, their gut microbiome becomes less and less diverse. You ultimately have only a few species. So it's this, number one, it's this huge diversity that makes a big difference. And number two, we now know that there are certain bugs that really make the difference. And the longevity paradox is actually teaching people how to nurture the bugs that are very interested in keeping you alive. Another way of looking at this, you're basically a condominium for these bugs, for bacteria.
So how do we attract all these diverse good bugs?
I'm so glad you asked. So we know that good bugs like to eat certain foods.
Okay.
And a lot of this was actually based on, there's this fascinating creature called the naked mole rat. And naked mole rats, make sure everybody who's listening or watching Googles naked mole rats. And here will be my first controversial statement of the day.
If you want to see the rest of the video, check out the Lewis Howes channel on YouTube or Dr. Stephen Gundry on his channel. Let me know in the comments what you think about Dr. Stephen Gundry's advice to Lewis Howes on which foods to eat and which to avoid. Are there any foods you include in your diet that provide health benefits but weren't mentioned in the video? I'd love to hear your thoughts on this whole gut health and bioorganism topic.